Now, I'd love your thoughts on whether it's time to scrap the NHS. 0207 862 2222. A new report has argued that more lives could be saved if the health service was no longer controlled by the government. The Institute of Economic Affairs, which Reem actually works for, think putting our health in the hands of private companies will save lives. Their report said countries such as the Netherlands, Czech Republic, Slovakia have successfully moved from NHS-like systems with improved results. So let's have a look at this. Now, first of all, let me just talk about building a hospital, because there are lots of ways of building one. And here we have an amazing bit of time-lapse footage of a modern hospital going up. And you see the complexity, don't you, of all the different wards and the floors and the surgical theatres. But let's transpose this. Are there just as many ways of building a health service? That is the question.
July 5th, the new National Health Service starts, providing hospital and specialist services.
So, building this health service, 1948. That's when they said they're going to bring the private healthcare together and form the NHS. Big queues. Health checkups were offered. Optical services were offered. New pairs of glasses, free of charge at the point of supply. A&E. Dentistry, remember that when we had that? Oh, and here we are. Maternity. Now, that baby was born in 1948, right at the start of it. And I was doing my calculation. I reckon that baby is now 76 years old. Let's find an old man photo. 76-year-old. She's this one here. Snatch that, put it in. Lovely. There he is. He needs a lot of care. He may live for another 20 years, this guy, right? And the problem is the NHS was invented before they invented the calculator. Fundamentally, they never worked out how much it was going to cost. So this guy here, let's look at his prospects. This is life expectancy. The green line is men. 1870, you're going to live to be 42 if you're a bloke. 1900, you won't get to 50 if you're a bloke. Women just go a little bit above 50. Then we go to roughly mid-40s, post-war. You live to be 63 if you're a man. And here's the problem. That's when adult males died in 1948. He was a baby. By 2024, the baby born in 48 is still going strong. So what are his prospects? You probably could guess this. How much longer would he live on average if he is 75, 76? Well, a 75-year-old man will live another 12 years on average in this country. Great news in a way, but he needs, as I say, a lot of healthcare. So this is where Reem's group come in, and they are the IEA, the Institute of Economic Affairs. They talk about denationalising the health service. Oh my goodness, everyone's going to throw their hands up. They say it's a sacred cow that must be put out of its misery, quoting the Times. 40% of day-to-day government spending on health. They say that's crazy. This is the Telegraph, showing that the NHS performs worse than the health service in countries like France or Germany. They're just not doing very well. And what they do in this report, I've cut out nearly all of it, and I've just got to, sorry, Reem, just got to the conclusion. They say we should have what they call SHI. I think there's a letter missing there. Social Health Insurance. SHI. That was a silly joke. You get it? I'm not suggesting it is SHI and then another letter, but it's just that you need to find another name for it for a start.
But it's not a very good name.
It's not a good name. But listen, I mean, the report's fascinating. We go from NHS to SHI. Now, in 30 seconds, tell our viewers what SHI is.
What SHI is? Well, as we already know, there is no other country in the world that has a national health service like we do. We spend just below £200 billion a year on the National Health Service. So, as you said it in your excellent demonstration, Jeremy, back in 1948, when the NHS was founded, it was founded on the principles that it's going to be free at the point of use and available to all. But at the moment, we are effectively seeing huge amounts of people on waiting lists, and we are spending huge amounts of money on the NHS through general taxation. So is it really universal for all, and is it really free at the point of use? The question is, how do we reform it? How do we actually change these ideas? Now, we can take the existing infrastructure in the NHS and allow for competition, which effectively means that people, patients, the general public, every British person can choose where they get their healthcare from. They can choose between providers. Now, the reason why that ends up resulting in a more efficient system is because they want your money. They want to do a good service for you because you get to choose between them. This is the case in the Netherlands, it's the case in Germany, it's the case in so many other European countries.
What if I'm living in an area where my hospital isn't offering the best service and it just goes bankrupt? All that's happened is I haven't got a hospital anymore.
No, that's not exactly true. So the hospital wouldn't just disappear. The hospital building is still there. It would be taken over by a better provider.
By market
So
forces.
insurance providers effectively have to compete with one another so that you, Jeremy, can receive the best healthcare as possible.
Arguably, nothing could be worse than the system we've got now, but maybe it can be, because it sounds like you're talking about America there. America is a basket case.
I'm not talking about America. I'm talking about mainland Europe. I'm talking about the Netherlands. I'm talking about Sweden. I'm talking about Denmark. I'm talking about
Carrie, what do you think?
countries like Singapore.
SHI, I must be careful with the name.
Well, the NHS, I think, is one of the greatest things that Britain has ever brought. And and I'm not just being like sentimental, so therefore we have to keep it. But I do think that what we have done is had very top-down restructuring. We've had integrated care systems. They've only been working for 2 years. We don't even know the results of those 42 systems that are running. Really, in 2 years, we need long to let things bed in.
Hang on, we've had 76 years now, and.
But
it's a victim of its own success. That guy should have been living to 63. He's living to 83.
It's worse than that. It's worse than that because it was built on critical care, and over nearly 50% of people over the age of 18 have chronic conditions like me, like Crohn's disease. I'm going to be ill for the rest of my life. So from 18 all the way to the end. So with that, I need to access services, and also bearing in mind the average literacy age in this country is age 9. So how are we expecting people to understand health literacy? Understand how to.
Can I just on that point? If you take somebody like Carrie, and you've said you've got a chronic health condition that is lifelong, she's not going to get insurance.
She will get insurance. That's the point. So if we're looking at the Netherlands as an example, the government has a standard minimum package that every insurer has to provide. So, Carrie, you're all good. You're going to be provided for.
What
will my payments be? Because I've got a long-term, quite serious health condition.
So there's no difference based on your health. So in the Netherlands, it's not that if you're worse off, if you're more unhealthy, if you're a smoker, whatever it is,
there's just
you don't pay any more. It's basically in a very similar system to the fact that we pay tax at the moment. The difference, though, is that because the funding structure is competitive, it means that they are going to want you to choose them, not the other way around. You're not going to be begging for an appointment. They're going to be begging for you to come to them. And therefore, they're going to cater the services so much more efficiently.
That's not how it's worked so far, is it? We know that so much
we don't have
the
that
NHS
system yet, Carrie.
But we have a lot of the NHS has now gone to private companies. The private companies are involved ridiculously.
Do you have a choice between different providers? No. So there's one national health service that the government controls. The government controls the National Health Service. Can I just say, we're talking about
look what happened to our trains, and look what happened to our gas and electrics. Literally, we're dying over this stuff.
Quickly, I'll take
the point is, if we look at the European systems, they provide so much more better care. We currently have in the UK the second highest level of avoidable mortality rate in the UK, second in Western Europe.
Right.
So
we're making. I can see the argument. One brilliant thing about your argument is that a lot of what we are suffering from is we bring on ourselves. I mean, obesity being the classic thing. And once you have to pay for the effects of your own health choices, you may think again about the second pizza. Helen in Somerset, good afternoon. Morning. Hello.
Hi.
Happy
good
Friday.
Morning, Jeremy.
Hi, what do you think this is?
Morning.
So Reem has gone into the mouth of the cannon here. She said the NHS is over.
I absolutely say that we need to completely protect our NHS. It's a fabulous service, so free at the point of need. But I think that us as the general public actually need to take some responsibility for the demise of our NHS. There's an awful lot of game playing. So when I was a senior sister and we were trying to discharge elderly patients, we would get a phone call literally saying, oh no, I can't have mum, dad back on this day. I'm going away on holiday. I won't be available for 2 days. So that bed would then be blocked for 2 days. If people actually realise the cost per bed day of keeping somebody that's medically fit for discharge, and I think that's the thing. I think we do not realise the cost of the services. A simple ask was, would you go and pay 16 pence for paracetamol when we discharge you from surgery because it costs us £9 through NHS procurement to give you your 16 pence paracetamol? Would you help to save us money? No, we won't. It's our right. You give it to us for free. We've paid our taxes.
But I mean, but you know, the discharge thing is classic. And I don't know how this is a separate thing, but older people ending up in hospital after a fall, let's say, I had a relative in this situation. After a week, they could go home. Getting them home is a big process. And the default is that they stay in hospital, and they may stay there for years.
This is difficulty. And I think, so Helen, thank you so much for your call. And I think what's really interesting about that perspective is that there is a recognition in the public, there's a recognition with the British people that change needs to happen, but it's not good enough just saying we need people to take more responsibility for their actions. What a social insurance model would do is ensure that people are effectively incentivised to. So because you're paying for your service, you're going to be incentivised to actually make sure you're not wasting it.
And then in Hertfordshire, what do you think of this system?
Well, what we've got at the moment is a pile of rubbish because we don't have a national health service. We've got 4 regional health services because somebody in Carlisle has to pay £9 per item on a prescription. A couple of miles down the road in Gretna Green, it's free. Yeah. So how can that be a national health service?
Well, we've got different nations, haven't we? And you're talking about England versus Wales versus Scotland.
Well, they're not real countries. We've got one government controls the lot.
Well, we don't, do we?
You know,
but that doesn't really matter. I mean, the point is that wouldn't this make... I'm sensing you think this is a good idea. Everyone has to get their insurance. Everyone has to think more about their own health. And they have to search for the best surgeon if they need an operation.
Yeah, over the last few years...
Go on, Carrie.
They can't do that. I just don't believe they can do that. I think this is about joining together. Wait just a minute. I think this is about joining together. We have health and social care together. They don't work that well together, even though we have a minister for them. But we should have education in there. We need to have ground level, as people are growing up, educated into understanding health, understanding what smoking and obesity, understanding the impact of those things.
So, Carrie, I think you're absolutely right. I think education can be a huge part of it. But I think the British public are already well aware of the fact that smoking is bad for them. They're well aware of the fact that these foods are bad for them. But the incentive structure at the moment is, I don't bear the cost of it. What we can do is see a system where actually people can choose where they get their healthcare from. And I don't think the British public are too stupid to understand how to shop around. They're able to do it for food. They're able to do it for anything else. They're able to do it for education. Why can't they do it for health?
I don't know. I mean, you've got people who are disadvantaged and distressed living, and kids involved. Kerry in the Scottish Highlands. Hi, Kerry.
Hi there.
I'm sensing that we do think the NHS is on its knees and not going to get on its feet again.
Well, I mean, I work for the NHS, have done since 1993, also a senior staff nurse manager. I'm in Scotland, so we are different up here, where we don't pay for prescriptions and things like that. The thing about the NHS is you get top quality service and top quality care at point of service. The minute you walk into A&E or go to your GP and the GP sends you into hospital, you are looked after by some of the most qualified people you will find.
Not sure I'd agree, but anyway, you carry it. I mean, just because you've got to access the GP. Yeah?
Yeah, I mean, accessing the GP is difficult. I do agree with that.
That's all that matters.
It's impossible.
I'd rather see a bad doctor today than a good one in 3 weeks. I'm really sorry.
Why would the doctors change? Kerry, why would a system like this mean that all the doctors suddenly disappear? They're still going to be working in the system.
Yeah, well, I just think that, from my point, I'm probably not putting it across very clearly.
Go ahead, Kerry, go ahead.
Is that... literally yesterday, I was in a chemist picking up a prescription, and there was an American tourist behind me, and they were picking up a prescription, and they went to the counter and said, "How much do I owe you?" And it was, "You don't have to pay us anything." And the woman was amazed. She had a tiny bag. I don't know what was in it.
An American tourist was not... That's astonishingly... That's terrible.
She wasn't charged. That would have been her insurance.
Ah, OK. That's her insurance. I was going to say, if the Scottish Government is paying for tourists' medication now...
That's not very good. No, but also we've got to remember that the Scottish Government raise less in taxation than they spend. So effectively, English taxpayers
London,
are actually subsidising Scottish prescriptions.
Have we got time quickly to take Sharon in Staffordshire, who's been hanging on? Hey, Sharon, what would you like to say?
Good morning, Jeremy. Good morning, panel, Cara and Reem. Now, I agree with Reem 1,000%.
OK.
Cara, I love you loads, but we cannot keep funding the NHS. It's been paid for by taxpayers, which it's been abused by people that don't work, and they go into the NHS and they don't even want to leave.
Well, yes,
they don't even want to leave.
The poorest in our society need the most healthcare. That's a fact of life. So that's not abuse. That's just kind of the way it works, isn't it? And they've got all kinds of problems.
No, but Jeremy, it has been abused by British people and foreigners. It really is. I know for a fact it is. You know, foreigners come in, they get treated. Oh, we're gonna recruit the money back from their country, which they never do.
I think that's a very London thing, that. But I know that does happen. But I think the bigger problems. The problem's about the fact that the NHS isn't there for us when we need it is a universal problem. So you want it to go to insurance?
Yes, I want to go to insurance because I work. I wanted to get an appointment. I couldn't get an appointment with my GP yet. I pay, I contribute for years and years, and I can't even get an appointment. How is that fair?
Thank you, Sharon. Later is the papers and everything else.